6 powerful vitamins that can transform your fight against sciatica. Have you ever felt that persistent pain in your lower back that seems to travel down into your hips, thighs, and even calves? Have you ever stopped to think about what could be causing this uncomfortable and debilitating feeling? What if there was a natural way to alleviate and even prevent this pain without having to resort to invasive methods? Sciatica pain, which affects millions of people around the world, is more than just a nuisance. It's a condition that can limit your mobility, harm your quality of life, and steal your daily energy. But is it possible to treat this pain with simple changes to your diet and routine? Today, let's explore together the causes of sciatica pain, the impacts it can have on your body, and the vitamins and habits that can make it a problem of the past. Get ready to discover valuable information that could make a difference in your life. Let's get started. What causes sciatica pain? Sciatica pain arises due to compression or irritation of the sciatic nerve, the largest nerve in the human body. It extends from the lower back to the feet and is responsible for transmitting nerve signals between the lower spine and legs. When pinching occurs, whether due to a herniated disc, bone spurs, or other structural problems, the pain can radiate intensely. Furthermore, some factors can aggravate or trigger this condition. Prolonged poor posture, a sedentary lifestyle, and being overweight are common enemies of spinal health. For people who spend a lot of time sitting or in uncomfortable positions, the risk of sciatic nerve compression increases considerably. Another lesser-known but equally important cause is a lack of essential vitamins. A lack of specific nutrients can weaken nerve structures and worsen pain. This relationship between nutrition and the nervous system will be explored throughout this content. Is it possible to reverse sciatica pain without surgery? Yes, in many cases it is possible. Although some serious situations may require surgical intervention, most cases of sciatica can be treated conservatively. Lifestyle changes such as regular exercise, posture adjustments, and adopting healthy eating habits play a crucial role in recovery. Specific stretches, recommended by professionals, help relieve pressure on the sciatic nerve and strengthen the muscles that support the spine. Additionally, supplementing with vitamins and natural anti-inflammatory compounds can offer significant relief. Studies have shown that nutrients such as B vitamins and omega-3 fatty acids are essential for regenerating nerve cells and reducing inflammation. Even so, it is essential to remember that each case is unique. Consulting a healthcare professional is essential to identify the specific cause of pain and create an effective treatment plan. What happens to your body when you suffer from sciatica pain? Sciatica pain doesn't just affect the lower back. When the sciatic nerve is inflamed or compressed, several areas of the body can be impacted. Initially, you may feel a tingling or numb sensation that starts in your lower back and travels down your legs. This numbness may be accompanied by sharp or throbbing pain, which worsens with specific movements or long periods of inactivity. Over time, if left untreated, sciatica can lead to loss of muscle strength in the legs, impairing the ability to walk or perform everyday activities. Additionally, persistent inflammation can trigger physical and emotional stress, affecting your overall well-being. Therefore, it is important not to ignore your body's signals. Identifying the source of pain and taking steps to treat it can prevent complications and improve your quality of life. What are the consequences if you do not treat sciatica pain? Ignoring sciatica pain can bring a series of complications. Prolonged inflammation of the sciatic nerve can lead to permanent nerve damage, resulting in loss of feeling or mobility in the legs. Additionally, constant discomfort can affect sleep, make it difficult to concentrate at work, and limit the ability to perform simple tasks, such as walking or lifting light objects. Lack of treatment can also cause secondary problems, such as muscle weakening. When the muscles around the spine and legs are not used properly due to pain, they tend to atrophy, making recovery even more difficult. Therefore, taking care of sciatica pain from the first signs is not just a matter of relieving discomfort, but of preventing consequences that can profoundly impact your life. How to save your quality of life. Even with sciatica pain. Maintaining a good quality of life, even when dealing with sciatica, is possible with a combined approach. Investing in practices that alleviate discomfort and strengthen the body is essential. Low-impact exercises such as swimming or light walking help maintain healthy blood flow and reduce muscle stiffness. Physiotherapy sessions, in turn, are essential to correct imbalances in the spine and surrounding muscles. Nutrition also plays a vital role. Consuming foods rich in antioxidants and vitamins contributes to nerve health and the reduction of inflammatory processes. Additionally, practicing relaxation techniques such as meditation or yoga can help control stress levels, which often worsen the perception of pain. By combining these strategies, it is possible to minimize the impacts of sciatica and resume important daily activities. What tests should I take to identify the cause of sciatica pain? If you suspect you are suffering from sciatica, specific tests can help identify the source of the problem. The first step is to see a doctor who will evaluate your medical history and perform physical exams to determine the exact area of pain. Furthermore, imaging tests such as X-rays, MRI, or CT scans are essential to detect herniated discs, bone spurs, or other structural changes that may be compressing the sciatic nerve. In some cases, neurological exams are recommended to evaluate nerve function and identify signs of more serious damage. Nerve conduction tests may also be performed to measure the speed and efficiency of electrical signals in nerves. With an accurate diagnosis, it is possible to develop an effective treatment plan, ensuring a faster and more efficient recovery. 1. Vitamin B6, the shield that protects your nerves against pain. Vitamin B6, also called pyridoxine, is a powerful ally in protecting and maintaining the health of the nervous system. It plays an essential role in more than 160 enzymatic processes in the body, including the production of neurotransmitters and the strengthening of myelin sheaths, which surround and protect nerves. Myelin sheaths function as an insulating layer for nerves, ensuring that electrical signals are transmitted quickly and accurately. When these sheaths are weakened or damaged, nerve impulses are interrupted, leading to symptoms such as tingling, numbness, and severe pain, common features of sciatica. Furthermore, vitamin B6 helps in the production of serotonin and dopamine, substances that regulate mood and pain perception. Its deficiency can aggravate symptoms of neuropathic pain, such as those experienced during a sciatica attack. Natural sources of vitamin B6 include foods such as bananas, chicken, salmon, spinach, and chickpeas. However, for people with significant deficiencies or conditions that affect absorption, supplementation may be necessary. It is important to consult a healthcare professional before starting any supplementation to ensure that the doses are appropriate for your needs. Maintaining optimal levels of vitamin B6 in the body is like building a barrier against nerve damage, helping to prevent and alleviate the discomfort caused by sciatica. 2. Vitamin B12, the silent repair of your neural health. Vitamin B12 is another protagonist when it comes to taking care of nerve health and preventing pain such as sciatica. This vitamin is responsible for the production of red blood cells, cellular energy, and most importantly, for the regeneration of myelin sheaths, essential for protecting nerves and ensuring their proper functioning. A vitamin B12 deficiency may be silent at first, but eventually manifests symptoms such as extreme tiredness, anemia, numbness in the limbs, and neuropathic pain, including sciatica. This is because without sufficient levels of this vitamin, the body cannot maintain the integrity of its myelin sheaths, making nerves more vulnerable to damage and inflammation. Risk groups include people with vegan diets, as vitamin B12 is found mainly in foods of animal origin, such as meat, eggs, milk, and dairy products. Elderly people and individuals with conditions that affect nutrient absorption, such as gastritis or celiac disease, are also more likely to experience deficiency. Vitamin B12. Supplementation is highly effective in preventing complications related to neural health. Studies show that it not only reduces nerve inflammation, but also helps recover from pre-existing damage, relieving pain and improving motor function. Taking care of vitamin B12 levels is an essential step to rebuild neural health and combat sciatica pain efficiently and lastingly. 3. Omega-3, the antidote against inflammation you need to know. Omega-3 fatty acids are more than essential nutrients. They are true allies in combating inflammation and neuropathic pain, such as sciatica. These compounds help form cell membranes and ensure the integrity of the central and peripheral nervous system. What makes omega-3 so powerful is its ability to reduce inflammatory processes throughout the body, including those that affect the sciatic nerve. When this nerve is inflamed or compressed, omega-3 acts directly to relieve swelling and improve local circulation, promoting tissue recovery. Additionally, omega-3 has antioxidant properties that protect nerve cells against damage caused by free radicals. This is essential to prevent long-term problems, such as nerve degeneration, and maintain the functionality of the nervous system. Food sources rich in omega-3s include fatty fish such as salmon and sardines, flax seeds, chia seeds, and walnuts. For those who have difficulty consuming these sources regularly, fish or algae oil supplements are great alternatives. By including omega-3s in your diet, you will be strengthening your nervous system and significantly reducing your risk of sciatica attacks. 4. Vitamin D, the sun's secret to strengthen your spine. Vitamin D is often associated with bone health, but its role goes far beyond that. This vitamin is essential for neuromuscular health, playing a crucial role in relieving muscular and neuropathic pain, such as sciatica. One of the most important functions of vitamin D is the regulation of calcium in the body, essential for maintaining strong and healthy bones. This helps prevent wear and tear and bone deformities that can put pressure on the sciatic nerve. In addition, vitamin D also works to reduce the sensitivity of nerve fibers, which alleviates pain symptoms. Vitamin D deficiency is common in people who live in regions with little sun exposure or who avoid sunlight for long periods. Although foods such as fish, eggs, and fortified milk can provide this vitamin, supplementation is often necessary to achieve adequate levels. Studies show that people with healthy vitamin D levels report less back pain and greater ability to perform physical activities. Incorporating this vitamin into your routine is an essential step to reducing the frequency and intensity of sciatica attacks. 5. Glucosamine and Condroitin, the dynamic duo that takes care of your joints. Glucosamine and Condroitin are compounds naturally present in the human body, essential for joint health. When it comes to sciatic pain, these substances stand out for their ability to protect joints and relieve friction between bones, often responsible for pain associated with compression of the sciatic nerve. Glucosamine is found in the fluid surrounding the joints, while Condroitin is located in the articular cartilage. Together, these substances help maintain joint elasticity and lubrication, preventing excessive wear. In the case of sciatica, especially when it is caused by herniated discs or bone deformities, supplementing with glucosamine and Condroitin can offer significant relief. By reinforcing the tissues around the spine, these compounds create a kind of shock absorber, reducing friction and inflammation. Natural sources of glucosamine and Condroitin are limited, so supplementation is the most common way to obtain them. Many studies demonstrate that regular use of these compounds can reduce joint stiffness and provide greater comfort during movements. By incorporating glucosamine and Condroitin into your routine, you will be strengthening your joints and reducing the impacts they can have on the sciatic nerve. 6. Devil's Claw, the natural alternative that relieves chronic pain. Devil's claw, a plant native to Africa, has been widely used in natural medicine to treat chronic pain, including sciatica. Its main active compound, arpagoside, has potent anti-inflammatory properties that help reduce swelling and relieve pressure on nerves. Studies show that devil's claw is effective in reducing pain in the lower back, making it an interesting alternative for those looking for natural treatment options. Its action is similar to that of non-steroidal anti-inflammatory drugs, but with a lower risk of side effects, such as gastric problems. To ensure the benefits of this plant, it is important to choose supplements that contain an adequate concentration of arpagoside. Furthermore, use must be guided by a healthcare professional, especially in cases of more intense chronic pain. Devil's Claw is not only a natural option, but also a safe way to alleviate the disabling symptoms of sciatica and improve your quality of life. 7. Simple habits to relieve sciatica. 1. Anti-inflammatory teas and drinks, your best ally against pain. Drinks such as turmeric tea, ginger tea, or juices from antioxidant-rich fruits such as cherries and blueberries help fight inflammation and protect nerve tissue. A daily cup can make a big difference in reducing pain and strengthening the body. 2. Restorative sleep. How sleep can transform your recovery. Sleep is crucial for regenerating tissues and reducing inflammation. Establishing a healthy sleep routine, including reducing the use of electronics before bed, helps the body rest and recover more efficiently. 3. Escape immobility. Simple tips to keep your spine moving. Staying in the same position for a long time, whether sitting or standing, can worsen sciatica. Switching between positions, stretching regularly, and walking for a few minutes throughout the day can relieve pressure on the sciatic nerve. 4. Stretches that can do miracles for your flexibility. Simple movements, such as gently bending forward or stretching your legs, help decompress your vertebrae and relieve tension on your nerves. Daily stretching is a powerful tool against sciatica. 5. The power of meditation. Free yourself from pain with your mind. Meditation not only reduces stress but also helps relax your muscles and improve pain perception. Simple mindfulness practices can be an effective complement to physical treatment. 6. The touch of warm water. Reduce pain and relax nerves. Warm baths or hydrotherapy sessions promote muscle relaxation and improve circulation, helping to reduce the pain and discomfort of sciatica. 7. Thermal packs, the quick and practical solution for difficult days. Thermal patches are an excellent alternative for relieving unexpected bouts of pain. They release heat for several hours, helping to reduce inflammation and relax the muscles in the lower back. Sciatica pain may seem like an insurmountable obstacle, but with the right tools, you can take control of your health and quality of life. Small lifestyle changes, combined with relief strategies, can transform your daily life and allow you to live without limitations. Remember that taking care of yourself is a daily commitment. If you need guidance, seek out a healthcare professional. Don't give up on seeking relief and well-being. Every step towards this is worth it. Your journey to a pain-free life begins now. Invest in your health, share this knowledge with those you love, and above all, continue to believe that change is possible.